Good afternoon, everybody, and welcome to the annual general meeting for the Vale of York CCG for the year ended April 2020. My name is Nigel Wells, and I'm a GP that works in Selby, and I'm also the clinical chair of the Vale of York CCG. This, of course, is a public meeting, and it's great that we're being able to stream this live using Zoom platform and YouTube. And apologies in advance if we do have some technical issues. However, there will be the ability to see it again on the CCG website. This is a public meeting. However, a lot of our GP practices attend, and also our governing body lay members. And I've had apologies today from Dr. Gordon Orr from Front Street Surgery, and also Andrew Inglis from Tadcaster Surgery, as well as David Booker, who's the lay member for chair of the Finance and Performance Committee, and Dr. Chris Stanley, who's our central locality GP representative for the City of York. In a minute, I'm going to agree the minutes of the previous AGM, and then we're going to go on into the agenda for this annual general meeting to ask for updates from the directors of the CCG on the year of 19 to 20. And of course, then there will be a presentation of the 1920 financial accounts from Simon Bell. It's sometimes difficult to look back and remember previous years, and I suppose this time it is harder. It's probably harder to reflect and understand all the positive things that were done in the 10 months in that financial year, and that were implemented in that year, because of the understandable and complete focus on COVID-19 since March onwards, or February and March onwards. This year, as I've said, we're asking all of our CCG directors to present for their directorates and look at the achievements in 1920, as well as the reflections from the first 6 months of this year. Now I'm going to agree the minutes of the last AGM, and these are available online at the CCG's website. And I have ensured that any actions that were in that have been completed. Before I open the floor to our next speakers, I'd like to take this opportunity to thank all patients, public, NHS and social care staff for their hard work and support given during the COVID-19 pandemic. The NHS has been so appreciative of the support the public have given. And we have seen innovation on an unprecedented scale, with GP surgeries and hospital services quickly embracing new ways of caring for patients and for keeping them safe. We are truly in it together, so we have to ensure that we all continue to do the right thing at the right time and in the right place. I'm now going to ask Phil Metham, the Accountable Officer for the Vale of York CCG, to present, and then he'll be followed by the directors of the CCG.
Thank you, Nigel, and good afternoon, everybody. I am the Accountable Officer of the Vale of York CCG, and just a few opening comments from me, which resonate with the introduction from Nigel as clinical chair. So 1920, what a year that was, with the final 2 months of that year being dominated by the COVID pandemic. But before then, the year was one which was characterized by achievement. And we'll hear more of those achievements in the presentations that follow. I did want to take this opportunity to say thank you to a range of people. Firstly, the governing body. I'd like to thank the governing body of the CCG for supporting me and the directors and all of the team for the work that we have carried out on behalf of the people that we serve. I'd like to thank our member practices, our constituent practices and their leads for continuing to work with us and engage with us in a constructive way, which enabled us to focus on the patient, which is what we always have tried to do. I'd like to personally thank the directors for their support and for all of the work that they've done with their teams, and thank you to all of the staff. We are and have become a CCG which is recognised for its value-based approach, for our consistent behaviours of putting our patients at the foremost of all of the work that we do, for the way that we try and frame and lead all of our conversations following clinical advice. We have become an organisation that is widely recognised as one of the anchor organisations across the Vale of York, representing patients, caring for them and improving their outcomes. Our providers and partners have recognised that value-based approach and have consistently worked with us in that way. So I would like to thank them and their boards for that. And I look forward to working with them and all of our team in this year ahead, which will continue to present us with unprecedented challenges. And so far, as Nigel has indicated, the work that we have done together has created innovation that we haven't seen before. And I am very proud to say that I am part of this health and care community, and I'm very proud to be the accountable officer of Vale of York CCG. And we'll hear now a range of presentations from our director team, which illustrate why 2019-20 was a year of achievement and success for our CCG. Thank you. So over to you, Simon. Simon is the Chief Finance Officer and will present the accounts for us now.
So thanks, Phil, and thanks, Nigel. A very brief presentation from me. If we just move on to the next slide. It's really easy to overlook how big last year was in terms of recalibrating the organisation. We had a tough time in 18-19. Plan didn't deliver, disappointment and so on and so forth. But we took a principled stand. A principled stand in 1920 to say, actually, let's just get hold of our own position and let's say what we can do. And we set that plan at an 18.8 million deficit, which is great. We're spending 18.8 million pounds more than we're supposed to. But we set that in all good conscience, thinking that's what we needed to do for the safety and quality of services that we're trying to aspire to, and for improving services that are clearly not where they should be. And that was not well received by our regulators, if truth be told. But we toughed that out, and that was good, and that was right. And I think that was a significant recalibration of our relationship with our regulator. This was us as an organisation saying, we know what we're about, we know our business, we know how to do this, and just because you think you've got some targets that you think we should hit, that doesn't mean we're gonna just agree with them. So our regulators set us a deficit plan of 14 million. We didn't think we could do that. So we went with 18.8 and we delivered it. And that was not easy. Everybody on the director team delivered a huge amount and in difficult circumstances. The control, the delivery, the turnaround that we experienced through last year just to deliver that plan. I know that doesn't sound great. £18.8 million more than we're supposed to spend. It's not great news, is it? But this organisation has never delivered a plan since 14-15. This was an important year of recalibrating our relationship with our public and our regulators, and we set ourselves a plan. The governing body accepted that plan, they approved that plan, and we delivered that plan. And that was done across the board. Every single directorate pushed themselves and went above and beyond, and we did it. So I think for me, 1920 was a year of turnaround, a year of a significant ramping up of control, a significant re-engineering and recalibrating of our relationships with the system. You know, we moved partners across the system to do things that they've never ever done before. So York Hospital always operated on a payment by results basis. Every operation gets a fee. Moved them off that. Never been done before. 20 years, never been done before. We moved them off that. So it's really easy to overlook the significant innovation and improvement that we as a CCG led. You know, if we hadn't done it, nobody else would have done it. You could just lose that in what's gone on over the last 6 months. But we did significant good to advance health and care and relationships and partnerships over the last year. We controlled our spend through 1920. We delivered our plan that we set out. That's the first time the organisation's done that since 2014-15. Now, you can't underestimate the significant disappointment that generates in the higher echelons of NHS hierarchy. We didn't experience any great interventions last year. You know, when I first joined the CCG, NHS England were encamped in our finance committees. Didn't really see much of them last year, and that's how I would like to see it. We're an organisation in control of our business, and I think that's recognised. That's recognised across the board. Now, at the end of the day, quite unexpectedly, the North East and Yorkshire region were given funds nationally. This was not something that was done across the board. It was pretty unique to North East and Yorkshire. We were given additional resources and we broke even. So effectively, you know, we were given nigh on £20 million to break even at the end of the year, which is nice. It's a marker of where people, you know, think we as a region are, but it doesn't move us any further from, you know, the underlying position, which is a really significant financial issue that we continue to deal with. So yes, we did break even. So that's what the accounts will say. I'll chalk that up to my success as the Chief Finance Officer. That's what my CV will say. But we all know the truth. That was just money allocated at the year end, and you know, it doesn't really detract from what we know is our challenge. I think the 6 months we've had with local authorities and other NHS partners, we've probably moved farther over those few months to recognise that we need to join up and do much better together. You know, for value for money, for patients, for carers, we do need to get ourselves into a more integrated position, and I'm you know, really enthusiastic that we're starting to see the makings of those conversations starting to happen, and that's something I'm really keen that we push on quite hard to try and get done. So we broke even. That means that our external auditors said we had an unqualified, true and fair view. So our accounts presented the right position for the organisation, and also that we hadn't, for a number of years, breached our statutory duties and spending more than we were supposed to. That's the first time since 2014-15. So that was pleasing. We do receive a qualified value for money opinion. What that means is our external auditors take a view of whether or not, as an organisation, we've got a cohesive and comprehensive plan over the next few years to get back to break even and live within our statutory duties, and we don't. Even though it complies with our regulatory requirements, we can't produce a plan that reduces our current underlying deficit, which is £26 million a year. We can't produce a plan that gets that back to balance in 5 years, and for that reason, our external auditors have qualified our accounts in terms of the value for money opinion. COVID-19, coming to that, has been incredibly significant. The first 6 months of the year, broadly in summation, we're going to be given enough money to break even. So whatever money we've spent, as long as it's been reasonable and we've taken a very controlled and measured approach to the spending we've approved, wherever that's been reasonable, we'll get that money back. The second half of the year, the world of the NHS will change. So from October onwards, all of our money, all of the money for York and North Yorkshire will go to North Yorkshire CCG. And we need to work through what that means for the next 6 months. I think, talking to Director of Finance colleagues, we are all committed to the sense that we need to get through the next 6 months. We need to do whatever's necessary to get through the next 6 months, and we need not overcomplicate matters. Now, alongside that, we'll run a program of change, which is about trying to do, our statutory duties as streamlined as we can. So where we can have one governing body, one finance committee, one set of accounts, we'll try and get to that, where we can free staff up to do the change that's clearly required in driving through the next phase of work. That's absolutely what we're all committed to. very, very easy to say, very difficult to do. So it's a very changeable affair. We a couple of days ago, well, one day ago actually, received our allocation and planning guidance for the next 6 months. Doesn't look like good news. Looks like we're short of money again, and that shouldn't come as any surprise, because that's where North Yorkshire and York has been for 20-25 years. So we'll work through that collectively. But I'm proud to say that actually, the work we've done as a CCG, and again, it's easy to overlook. As I said earlier, it's easy to overlook in the calamity that's happened. But the work we've done has progressed partnership working and collaborative working and working together, allowing clinicians to get in front of the situation and dictate how we are going to do things. We've created that environment. Nobody else has. That's just us. Us as individual directors, us as a CCG, us as a governing body, we've been able to get out there and say, this is how we think it should work, and actually it's starting to come to pass. So advances we've made around MSK and orthopedic changes, referral for expert opinion, and clinically led changes like that. I think that's what we've got to keep hold of, and what we've got to keep advancing. So a decent year. We've balanced the budget, but only because somebody gave us nigh on 20 million quid. But underneath that, we delivered a controlled, planned, sensible budget that was clinically led, and that's something we can all be really proud of, I think. I shall go on mute now.
Right. Hi, everyone. I guess it's up to me now. I'm Andrew Lee, the Director for Primary Care and Population Health. So I'm going to start with a reflection, really. 90% of healthcare takes place outside of the hospital. It happens in primary care. And primary care does it with usually 10% of the budget. So we are very lucky and fortunate in a way in the Vale of York in having such fantastic general practice teams out there who deliver fantastic healthcare for the sums of money they get. Certainly compared to other CCGs, we don't get nearly as much per head of population. But I tell you what, in this CCG, we squeeze value out of every pound. We really do, yeah. And it's not without consequence. It's hard work. And I know many of our primary care teams have been sweating their socks off and working long hours trying to meet that demand and need out there. So my hat's off to the teams on the front line. Yeah, you know who you are, and you really do lots and lots of good work for the system. Not always acknowledged, not always recognized. And it's easy when the queues are long and people can't get into practices to think that primary care is failing when it's not. Yeah, it's not. And as an outsider to York, I can certainly say that York, the Vale of York, has got some really fantastic general practices out there and fantastic teams, lots of innovation. Looking back, and 18 months ago, if you go back to March, April time last year, primary care networks didn't exist. It was a figment of imagination. Look how far we've come now. In that time, we as the CCG have really helped and worked with our primary care colleagues to set up primary care networks across the patch. We've got 8 of them. And I dare say they are probably far more developed and mature than a lot of other primary care networks in region. I would like to think we are ahead of the game here. And we're working hard to get our primary care networks at the forefront of innovation and delivering the best for people. Next page, please. Next slide. And we are supporting primary care through lots of different ways. Nigel and his team, for example, have been working hard to set up a whole bespoke set of training and education opportunities, not just for our GPs, but also for our practice nurses and practice teams. And we've been running that well over for the last year with some fantastic sessions. And I guess for me, the highlight was getting Professor Becky Malby to come speak to us and present some really forward-thinking ways of how primary care can be delivered. Next slide, please. As a CCG, we've tried to support our primary care, as I said, the development of primary care networks. This time last year, what was top of the agenda was our urgent care system. It was under a lot of pressure, high demand, waiting times were long, and it remains so even now. And we've started a very comprehensive piece of work to try and look at how we can improve our urgent care network. We're consulting members of the public, we've done patient surveys, we've consulted and run workshops with the clinicians to try and find what is the best way to look at redesigning the system, to make it more resilient, to deliver the best care for people at the right time and right place. And this is work that's ongoing. And we as a CCG also believe very much in the value of integration, of working together with others, of collaborating. And we've seen this in our work in the last 12 months through facilitating local collaboratives. We've supported the York and Healthcare Collaborative, the setup of the Selby sub-integrated care system, as well as a Vale of York systems group. We know we need to work with our local authority counterparts, with our acute trust counterparts, our mental health providers, and our third sector. So collaboration is key, and we will continue to work on that aspect as well. But we also know we need to get smarter with how we deliver care. And we've been doing a lot more population health management. So that's trying to identify where the needs are so that our most vulnerable patients' needs are met and address inequalities where they are. And we believe in supporting local innovation. For example, in Pickering Medical Practice, they've set up and run a project to deliver intravenous treatment for osteoporosis. We've got dementia nurses and care coordinators who've been hired and recruited to improve care right across the patch. And we've trialed health navigators, again, focusing on our most frail, vulnerable patients to try and support them in their homes and avoid unnecessary hospital admissions. Next slide, please. And as Phil says, who can forget the impact that COVID has had in March and April time. And this CCG, I'm really proud of the CCG team, every one of them. They have pulled out all the stops, put in lots of hours, working nights and weekends to get the system as best set up as they can. Next slide, please. For example, we've helped enable many practices to switch over into a new way of working, a lot more innovative IT solutions now. If you go back a year, very few practices were probably doing online consultations. Some were doing telephone consultations, but now a lot more. We've seen a complete channel shift across to using online remote consultations. And this has required a lot of investment in equipment, for example. And we've put out lots of laptops to our general practices, but also tablets into care homes so that care homes can connect with GPs remotely. Next slide, please. I mentioned collaboration, and my hat's off again to all our partners here in the Vale of York who have come together to work in the public good. I'm going to highlight a couple of key examples here. One of them is Peppermill Court, which was a step-down facility to help people get out of hospital and ease them back into the community. Normally, trying to set up such a step-down facility would take months, if not years. But all the agency partners working together managed to do it in 3 weeks, which is phenomenal. We've worked hard with the hospice sector and Marie Curie to set up palliative care pathways, and we've worked with our local medical committees, as well as North Yorkshire CCG and other partners, to try and make sure we get guidance and protocols out to primary care to try and make sense of all that information that was spewing out early on in the pandemic. Next slide, please. And as I said, this has led to massive service transformation. Now, virtually all our practices do something called total triage, where they will screen patients and help divert them to the right place. Not every patient needs to be seen face-to-face. Some may only need a phone call, for example, and others will need that face-to-face assessment by a GP. So introducing total triage models ensures the right people get to the right place. Yeah. I've mentioned the piloting we've done with Dementia Forward Nurse, for example, and a little later, I'm sure Michelle will talk about the efforts that her team has done to support care homes. Next page, please. Our comms team have worked extremely hard as well during the COVID period. This is all about getting messages out to our stakeholders, not just our providers, but also members of the public. And a key piece of work that stood out for me was back in April, May time, when we were trying to find out what was the impact of COVID, especially on some of our more vulnerable members of society, those with disabilities and carers. And they've done a lovely survey to find out what people were experiencing and feeling. And we're using that information to try and refashion how services are delivered in the Vale of York. Again, an example of how this CCG wants to meet people where they are and really add value in that. Next slide, please. And this is my last slide before I hand on. I could go on for hours, but I won't. It's just to say, our general practices, our nursing staff, they are a precious resource. They are humans. They are people. And they need as much support as everyone else in the system does. We are not machines, and it's important that we support the resilience of our primary care teams. And I'll include the care homes as well. Yeah. So we've done a lot of work trying to roll out education, trying to provide support. Many thanks to Simon and his team, for example, early on in the COVID pandemic, for releasing funds to help practices become COVID safe. Funds that were used to make sure that there was enough personal protective equipment and cleaning and so forth in surgeries, so that it was safe for both patients and staff. All of this takes effort. All of this takes resources. All of this takes time. None of this happened by chance. All of this was the result of the actions and efforts of our teams. So a really big thank you from me to everyone involved. Thanks a lot. And across to Michelle, I think.
Thanks, Andrew. Hello, everyone. I'm Michelle Carrington. I'm the Exec Director for Quality and Nursing. So that's a long title for Chief Nurse in the CCG. Next slide, thank you. So our AGM today coincides with World Patient Safety Day. And so I thought it might be useful to highlight a few things that might illustrate how we've kept people safe this year. I can't mention everything, so apologies, but those people that have really pulled out the stops this year and done their jobs really, really well. I applaud you all, and I apologise if I can't mention some of the things that you've been involved in. Next slide, please. Thank you. So I was going to look at both spectrums, really, from children to the elderly, and just pick out a few things. So we have implemented expert perinatal mental health services for mums who are pregnant and who are going to be in the first year of that motherhood. But we've not forgotten dads too, and our mental health provider provides a service which provides an app which they can access, which gives them day-to-day support so that they can bond with their babies and increase their confidence and well-being. And we're really proud of that service being established. It's taken quite some effort to do so. The picture you see there is of baby Theo, who is from our community, who sadly died of pertussis, which is commonly known as whooping cough. That happened after opportunities for the provision of a vaccine for Theo were missed. We heard his story loudly within our governing body and different meetings, and we made a promise to Debbie, Theo's mum, that we would share his story widely, and we have been working tirelessly with our providers and with national bodies to ensure that we reduce the risk of this happening again, and that work continues. For end-of-life care, we have increased the establishment in hospice care for children. I think those of us who believe in this very strongly have felt for some time that they are the second cousin really to the big hospice movement that you see for adults, and an excellent and quite discreet service which relies on public support and a lot of charitable donations. So we're really proud to increase the investment there. And I remember going to visit it with colleagues of mine and jumping on some of the equipment and having the best morning I'd had for quite some time. And we've also made sure that we've supported investment for York Hospital as well to provide care at end of life, whether that be in somebody's home with their family or whether that be in hospital as well. In order to meet the requirements of Ofsted and CQC, we've got a huge programme of work underway with our local authority colleagues and the brilliant York Inspirational Kids on areas of special needs, special educational needs and disabilities. And that work will continue for a good few years to come, I'm sure, and huge focus and work going on there. And I applaud and thank our colleagues for that. We're making real progress. Next slide, please. So we were mindful that during lockdown especially, opportunities to recognise and act on safeguarding concerns might be lost. And these are some of the ways, and I apologise, you might not be able to see all the very small writing there, but there was so much to put on, that our safeguarding colleagues have pulled together for me for this slide, which demonstrates all the different ways that we could support, particularly primary care, but our communities, to make sure that we were able to give support, training, guidance, information, to enable our safeguarding services to continue. So big thanks to our designated teams and our lead doctors out there as well. Thank you. Next slide. So children's mental health, my colleague Denise, who comes after me, will be talking about that. So over to our elderly population, our older people. The slide there of some people having fun describes really that we mustn't forget that life has gone on in care homes. These are people's homes and they're loved and cherished by the staff who work there. And it's been a really difficult year. We accept that some of those residents have died, and we accept that visiting your loved ones has been particularly difficult during COVID and continues to be so. So Andrew touched on some of the work that our care home team have been doing, and we couldn't do it without our partners in care, as we call them, which is a collaboration of health and social care staff. We've got nearly 400 members in our partners in care collaborative that meets regularly. It includes 82 care homes, 161 domiciliary care and assisted living facilities, and we've continued to support them as much as we can. We have implemented an enhanced offer to care homes along the 4 pillars that you can see there, which has been a regional development, but also requirements from NHS England, but also because we felt it was the best thing to do, and those efforts have come together in this offer for care homes. And that includes now things that we haven't had in place before. So each home has a clinical lead from primary care. Each has a district nursing lead, each has a learning disability need where that's appropriate, and the CCG provides the infection prevention and control training. As well as the training, we also continue our offer to care homes from my team, which includes the React to Red programme, so making sure that people have really good skin integrity, nutrition and hydration needs are met. And also how people can feel really confident and resilient if a resident begins to deteriorate, how they recognise that early and how they act on the signs of that and get help where it's needed. We've also worked with other partners at the Improvement Academy to develop an exploratory tool to understand what sort of factors have contributed to an outbreak in care homes of COVID. And it's got real legs now, and it's got a lot of interest. And what it does is allows us really quickly to get to the root cause of what might have happened in that care home, and aim to put in measures which might prevent the spread further. It's been a really good tool, and I think will probably be able to be used in other areas too. Next slide, please. So as Andrew mentioned, we've had a big training programme. So if you wonder what 100% of care homes trained in IPC means, that's a train the trainer approach, because we've got quite a number of staff in care homes. But up to date, that's 401 staff. But I'm sure that's more than that today, even because that training continues. And we also supported the system by setting up a site where primary care and other NHS staff could come and get a COVID test. And my staff and those from the local authority came together, and we took nearly 900 tests from staff who had symptoms potentially of COVID, and supported the system and enabled them to get back to work really quickly. I haven't mentioned it on the slide, but I wanted a big shout out to our research community. They've continued with their efforts. We do really well in the Vale of York in terms of research activity, and some of that has related to COVID as well. So we've been helping in the effort to learn more about this virus and hopefully in the future have effective treatments for it. Andrew mentioned again the digital support. What that actually means is it improves the communication. It allows virtual consultations if somebody needs eyes on from primary care that's in the care home. It might be a surprise to people that care homes aren't generally have NHS Net mail accounts. So it makes it quite difficult to communicate through email if everybody's on a different server. So we've really pushed on that, and the vast majority of our care providers have now got NHS mail. Capacity tracker is embedded in the vast majority of our providers. What that does is give us in the moment information about where care home empty beds might be, but it also gives us a wealth of other information so that we can support them as much as we can. And we get that information every day now. That's really helpful. I wanted to just mention advanced care planning. There's been an extraordinary amount of work done over the last year, not just because of COVID, but to have furthering conversations with our communities about their wishes and decisions at end of life, not just at end of life, but at various stages of perhaps needing treatment, and properly understanding what that might mean for somebody. And that is really, for any age, but particularly when you're the most vulnerable, and particularly when you might be be at end of life, sort of in the last 18 months. And I think it's a conversation we need to be braver about. We need to have much more commonality of understanding in, and there's quite a lot of work to do, but it makes such a difference to people when their wishes are understood and that they can get the care that they wish. I've just put two little logos on the bottom there because I wanted to shout out that the work that we're doing for care homes, we were finalists in the Nursing Times Awards this year, close but no cigar, and the HSJ Awards as well. And we've just heard that we again are finalists in the 2020 Nursing Times Award in the older people's category as well. So we're really, really proud of that. Next slide, please. And just to build on what Phil said at the beginning, these are some of the ways that we have kept our staff safe and ensured their well-being during the last year. We're proud to say that our staff engagement group is really active. It's continued to meet during the last year, and we were very quickly able to enable home working at short notice for people and continue to meet their needs should they need it in enhanced equipment or other things that would help them be able to work safely at home. Some people have really missed working with each other face to face, and the camaraderie which comes from being close to people and that human contact. And it's really, really difficult. And, we appreciate that. It's tough for all of us. And we've done what we can to ensure that those things can happen in a safe way. We've risk assessed all our staff, and we've allowed, as much flexible working as we can. What's difficult, I think, in the times and the ways that we're currently working is to be able to be sure that we still do that organisational development and learning, and make sure that we maximise opportunities for people and build on their talents. So we are resolute in that, and we're still committed to doing that. And I think we've learned some really good things about how effective our recruitment processes could be, for example, and how we might get messages out about making the NHS the best place to work in very quick ways that we've been able to do, which would have taken an awful lot longer in previous years. So, you know, our staff are our biggest asset. They absolutely are, and we couldn't have done the work that we do without them. So thank you everyone for that. And over to Denise.
Muted, Denise.
Thank you. Good afternoon, everybody. I'm Denise Nightingale. I'm the Director for Transformation for Complex Care and Mental Health. I'd like to start this afternoon with saying that in 1920, for me, there's been two real themes coming out. One has been about increased partnership, and some of my director colleagues have referenced that beforehand. And also about services that are about early intervention, getting in there early and quickly to prevent either deterioration or to prevent poorer outcomes further down the line. If I could have the first slide, please. The first key area I want to pick up on that is in children's mental health. All of these things on this slide are all early intervention. They're things that we've moved to in the last year. They're not instead of CAMS and secondary care mental health services, they're as well as. And I'll just pick a couple up. So if you look at COOS, this is obviously commissioned by our mental health provider across North Yorkshire and York. And it was only in place for 6 months of last year. But in those 6 months, there were over 8,000 logins to that site. It's highly recommended by the children who've used it, who would recommend it to other people who needed it. There's been over 1,500 hours of workers going into that, and that's within the first launch. We know, don't we, that if children can get early help, it helps them, it helps their family, and it stops them losing time at school. That's where we need to invest in terms of such services. The other one on here I'd want to particularly pick up is the Whole Pathway Commissioning Group. Now, for children and families who have mental health concerns or problems, they tell us all the time that they feel that services are not joined up. It's not of any importance to them whether or not care or support they receive is owned by a local authority or by a CCG or by CHUV. They just need the care and support during what is the most crucial time in their life. And what we have said is that that's what we want to do. We want to bring providers together to look at, and commissioners together to look at how we can get a pathway across that is unrecognisable about where one organisation starts and stops, but actually is there to support the whole pathway for children. At the other end, I suppose, of the continuum of this early intervention, and not on the slide, is the crisis service for children. Last year, the crisis service for children was launched, and is now 24 hours a day. But at the end of last year, was operating up until 12 midnight. And I don't think any of us should underestimate that if we have a child with serious mental health issues or family are really concerned, the support and reassurance that having a service to go to out of hours gives them to allow them to cope is so important. Next slide, please, Ellen. We should also pick up as well there are new capital developments. NHS England have funded the Beehive in York. This is a therapeutic short break service for children with complex learning disabilities and complex autism. And whilst you can all recognise, I'm sure, how important such a service is, which includes services from health and from social care, is at any time in the year. Just imagine what that service was offering during COVID, how crucial that was to keeping people safe and families able to manage. And at the other end again, the voluntary sector have come forward with all sorts of offers, both in terms of maintaining people with mental health concerns, or indeed early intervention. And Mind have got a programme with us for 3 years where they're providing art therapy for our children and young people with mental health concerns. Thank you, Eleanor. Next slide. If we move on to the adult mental health scenario, of course, we'd be remiss if we didn't mark that just before the year end, we got the opening of Foss Park, the new hospital, the amazing facilities. And as I understand it, people feel that in those facilities, they are able to recover better because the facilities are designed to support recovery. And what that must mean for our staff in Tuve as well, that are providing care in such an up-to-date and lovely environment with gardens to help people recover both quickly and thoroughly. Other areas, I know Andrew's covered them, but the IAPT services. IAPT services have grown and really improved their access times. GPs are now much more familiar with referring people into IAPT services. And at the same time, we've been able to co-locate 18 members of staff alongside GP practices to allow access for patients, but also to allow conversations to occur between CHUS, IAPT services and general practice. That has made a huge difference in terms of referrals and in terms of closer working together wrapped around the patient. We still encourage people to self-refer to IAPT and also GPs to refer themselves as well. Next slide, please. Again, the dementia specialist nurse that is a pilot in the City of York, really important that we get an approach that isn't just the GP practice or indeed the voluntary sector, but wrapped around a multidisciplinary approach in the Vale of York, in the City of York, that's the specialist nurse. In the Vale of York, those are care coordinators, all aiming though to make sure that these vulnerable individuals do not fall through a net. And the early intervention for psychosis, previously up until 1920, well below the national target in terms of access, now well beyond it, before COVID and during. Give me the next slide, please, Eleanor. Thank you. Moving on to the other area of my responsibility for continuing healthcare, you'll see that on that slide that the continuing healthcare team have met all of their targets throughout the year that they were required to meet, but also that in doing that, they made system improvements. They implemented personalised care planning for end-of-life patients and also personalised budgets for end-of-life care where that was appropriate. Perhaps more crucially, that team, that clinical team, currently case manage and support 605 complex patients with mental health and physical health conditions. And they are the most complex people that we have in the Vale of York, of which, of the 605, of which over 200 live in their own home. And so during COVID, it has been crucially important for us to keep in contact, make sure that their care and support is being delivered and has been reviewed. And I'd like to thank the team for delivering that. Next slide, please. Personal health budgets, again, a national target. But when you talk to some of the individuals in continuing healthcare, some of those people with very complex care needs, they do want to retain as much independence and as much choice as they possibly can. And sometimes if we offer them services either through private providers or through health services, those services can't meet the needs at the time that those individuals want them. So what we've been able to do as part of the national rollout is offer people personal health budgets. It allows them to have choice, it allows them to have control, it allows them to say when they want care and when they want the teams in providing it. In doing that, we've been able to increase our number of personal health budgets by 5-fold. And we were supported in achieving this by NHS England. And as a result, we've now got our own in-house experts, and we're now able to offer that to other CCGs, and we are supporting them as well in that. Thank you. Thank you.
Thank you very much, everybody. And finally, I'm just going to take a few minutes to discuss clinical transformation in the future. And as we've heard from all the directors, there's been great innovation and transformation at an amazing scale. And this is in part due to the fact that everyone has concentrated on a purpose. But we mustn't forget how and why that was done, and we must learn the lessons for the future. The main lessons, I think, are around trust and relationships and how we all came together on that common purpose, and how we blurred the boundaries between organisations to really push forward to do the best for our patient populations. The Vale of York CCG has implemented and supported protected learning time, and this has allowed clinical colleagues to meet both physically and virtually more recently, to learn and reflect from each other and to embed best practice for their surgeries and also for their patients. Going on forward from this, Simon talked about referral for expert input, and this will be a system that we will implement in the Vale of York CCG with York Foundation Trust, so that the patients and public that we look after can get the early help that they need without having to wait for long periods if that's not necessary. And this has been endorsed and looked at more regionally as well. In the wider system, we are a key partner of the Humber Coast and Vale Integrated Care System. And the ICS, the Integrated Care System, has collected over 330 innovations that have come in during the COVID pandemic. And many of those have stemmed from the work that's been done in the Vale of York and the City of York. We must and we will build on the innovation and transformation and continue to strengthen community care and prevention. The pandemic has shone lights on areas that need continued focus, and we know that about inequity and inequality. And as a CCG, as directors, as a governing body, and as member practices, we will continue to concentrate our efforts there. I'd like to thank all the GP practices, all the providers in our area for their hard work in this last year and the last 18 months. I'd like to really thank the CCG governing body and also the directors and all the staff at the CCG for all their work in that financial year, but also covering and helping and supporting the amazing effort for the COVID pandemic. Finally, as I bring the meeting to a close, I'd like to say to all to remember to keep yourselves, keep your families, and keep others safe by following the COVID precautions. And as I said at the beginning, we are truly in it together, so we have to ensure that we do continue to do the right thing at the right time and in the right place. Thank you very much, everybody, and I'll close the meeting there.